collective action, what we can do for better accessibility of prevention from mother to child transmission.
The video, please. The video. Yep. Would you mind to help me to clap hand when the song will be released, or you can stand up? This is the productions of HIV-positive women in Palembang, how they aspire about HIV has visibility in the health setting. My name is Najmah. I acknowledge my supervisors, Sari, Andajani, and Sharyn. This is a short video that was produced by HIV-positive woman, Ibu positive HIV in Palembang, in Indonesia. Next slide. Being a woman in Indonesia context, it means that are you married and you may not possible to get HIV. This is a little bit about me and with my 3 PhD junior. Next slide. The outline of my presentation today, we start from the what is prevention of mother to child transmission services, and finally I'll close with the conclusion. Next slide. What is prevention of mother to child transmission services? Every woman has a right for HIV screening so they can prevent HIV for themselves. If they were convert HIV positive and they don't want to have another case, they should have a right to access family planning to prevent unintended pregnancy. If they decide to get pregnant, they should access what we call program prevention of mother to child transmission services. It means she should access antiretroviral treatment during the pregnancy, cesarean section as the main option in the limited setting in Palembang, South Sumatra, and the baby should take prophylactic treatment for 18 months. However, if they don't access these comprehensive services, they put to risk HIV risk to the children. If the children is positive, they still have a right to be healthy. It means that they need a treatment, psychological support, and social support. Next, please. This is a study setting of my study. Next, my setting is in South Sumatra, Palembang, with a strong Malay and Islamic values and culture. Next, please. When we're talking HIV in Indonesia, it's still under 1% in general population. But you know the number of Indonesian population? 250 million. So it means big number. In the key population that we use term in Indonesia like men having sex with men, there are 10 HIV among 100 men having sex with men. In injecting drug use, there are 50 HIV positive among 100. And in heterosexual hegemony in Indonesia, they will get married.
Okay.
4 out of 10 new HIV positive in Indonesia are women, and the numbers start to increase year by year. Next, please. Unfortunately, most of the women in Indonesia knew their HIV in very late stage, after their husband or their children got sick or even dead, or themselves fall sick. Unfortunately, 1 till 4 babies that born from pregnant women living with HIV may have a risk to get HIV from their mom. If they access the services, they may reduce the risk until 2%. It means that the baby is more likely to be negative. However, only 1 out of 10 pregnant women living with HIV access the services. Next, please. The significance of my study so far, there is no published research that focuses on how to enable the women to access the services, and we also involve the participatory visual methods, and I believe that women are the real knower of their own solution. Next, please. So the aim of this study is to harness many forms of actions providing better access preventions of mother-to-child transmission services based on Indonesian context. Next, please. This is the study design what I used. You may have a look for a few seconds. Next. Initially I'm performing focus group discussions and informal interview among 18 HIV positive mothers, and then it was followed up by another focus group discussions among health workers and NGO workers. So I deliver the voices of the women to the health workers, and they to ask their response, because we use visual methods, so we perform their actions, and then finally I perform focus group discussion or informal interview to the HIV stakeholders. Next. And next. About feminist participatory action research. This is the principle that I've used in my study. First, HIV identity, self-image, and motherhood. Second, knowledge constructions. Third, consciousness raising. Fourth, social movement and actions. Fifth, connection and dissemination actions. And finally, initial change. Next. The result that we found from my study. Next. Next, we have watched this. So, every group of my participants, we create a safe space for them, what they want to do. Some of them decided to make a modified lyrics from traditional language that we have watched. Some of them prefer to do role play to aspire their voices, and some of them decided to produce a video through social media. Next. What is the aspiration from HIV positive women? Through the song of Chuk Mainlang, they aspire, please make visible HIV test. Make visible HIV test. So, for my observations, so far in Parliament context, I the health promotion or posters about HIV test for pregnant women. We can find screening certificates in front of midwifery, but no HIV test. And I found some of posters must put in the voluntary and counseling testing inside the room, who most of pregnant women would not see that. Secondly, they inspire about the midwife's role to engage, accompany, and also to promote HIV tests. In Indonesian context, HIV tests only can be accessible in the puskesmas or community health center and hospital. However, most of pregnant women come to midwife, private practice midwife. So they encourage to strengthen the role of midwife. And the right information about HIV. HIV now is not about sex worker again, injecting drugs users again. Upon cases, a doctor, a specialist, a midwife can get infected HIV. So we should promote that everyone are at risk of HIV, not only key population. And the last step they said about gender equality. Please not only offer to us HIV test, women, pregnant women, but our couple. Next slide, please. Through role play, another group of HIV-positive women aspire friendlier preventions of mother-to-child transmission services. Some of the health workers who have been trained, they will welcome to the HIV-positive patients. Unfortunately, not all health workers understand, and they have fear in their heart. If I treat them, I would get infected. Or what for? We treated the naughty person, naughty woman. So a training on how, not the training for health workers now is not about HIV again, but how to have HIV persons in health setting, how to deal with face-to-face. So it's psychological, mental of health workers should be strengthened. Next, please. From the perspective individual of HIV-positive women who have accessed the services, they said that we should strengthen ourselves. Through complicated health system in Indonesia, the women should strengthen their spirituality and their willingness. We can have HIV negative mothers, and they should engage their husband and their family. Next, please. From the health workers and NGO workers' aspirations, please. Midwife, when they know the patient HIV positive, do you think they will help them? Yes or no? A midwife, if they know their patient are positive HIV, will they help them? Yes or no? No. But we should aware. They have not well trained to do that, and they need such training on midwife, and they aspire that HIV test should be provided in the midwife setting. Next slide. And one of the video that produced by health workers, it is a specialist who are care with HIV positive women, and the video is about to embrace HIV positive women. It means that you embrace them, you save yourself, health workers. Within 2 weeks, I produced this video, and 200 people share about the video, and within 140 viewers within 2 weeks. And the video break the common assumption that if health workers care with the HIV positive patient, they will lose their patient. No, they have appreciation from the audience, from their patients. Finally, would you want to come to the final slide? This is from the health workers. Next. So from the NGO perspective, they said that we should strengthen cooperation within the people who get involved in HIV treatment and prevention. And finally, we suggest a socio-ecological of providing better access of PMTCT services. Firstly, next, women is the central issue. They should be strengthened. They should have good knowledge and good motivation. I can have HIV negative children. From the interpersonal, women should encourage their husband. If they decided to get married again after her husband's death, they should open her HIV status to the partner. Next, from the organization, friendlier health services, they need that. Next, community, simple thing, use social media, use a good persons in the health setting to promote HIV test, and it will be simple, very low cost to produce the video through social media. Finally, please, HIV test in Indonesia context not only mandatory to be over, we should change it mandatory to be tested. Thank you very much.
Can I just get the speakers up here again, Brian and Sharyn? We've got some time for questions. Do you want to start with your question?
Hello, good afternoon. So I'm a Japan Rehabilitation Center as well as a member of Takina, an artist collective working for advocacy. I also wrote a review for Berlin's Invisible to publish here. Anyway, I am very much interested with the arts, advocacy, and perhaps theater, and then there's digitized. It's a very wonderful thing to say, especially these days that everything has become humanizing. So there is an appeal to the human part of ourselves. And maybe this is more of an insight part question. Maybe how do we say, for example, democratize the art spaces in the digital world? Because when we say we want to produce digitized art, it presupposes that there should be an access to digital spaces and to digital technology. And well, of course, there is a nuance that here in the metro, everybody has apps, everybody has apps. But for example, in